Okay, I saw you on
How
TV
are you?
last night. Very
Nice to
good.
see you, man.
Yes, you're looking good.
Thank you.
Yeah, great cause,
Thank you.
too.
Yeah.
Governor Quinn, Lee Francis,
Yeah, you
CEO
saw
of the
you
Health
went
Center.
to Amherst.
I
That's
did.
where my brother went, one of my brothers. We are very grateful for this approval here today. Our Secretary of our Healthcare and Family Services is actually in Springfield right now testifying before the legislature to get our statute passed to expand our health coverage to people who don't have that. We also are going to be passing the legislation for the health insurance marketplace. Those are two things I talked about last week in our State of the State address, and it's very important that we, the people, band together for something really, really important. We can insure literally hundreds of thousands of people who today are working and are part of our society, but they don't have health coverage. The bottom line is every side of our state needs to have access to decent health care. And we're going to hear in a moment from a person who lives very close to me, where I live, who will talk to, testify to how important this mission is. We in Illinois, the home of our president, are going to work in the next 8 months to enroll as many people as possible. The official start date to enroll is October 1st. But we've got to get the word out about the opportunity to get health care coverage. But folks who are working hard, never had it before, we got to make sure we reach out to them.
Today, I'm pleased to announce that our department is conditionally approving the blueprint that's been submitted by the state of Illinois for a state partnership marketplace. And that means thanks to Governor Quinn's leadership, Illinois will be able to tailor the new marketplace that is available for open enrollment starting October 1st to the needs that are particular to the Illinois citizens. Today's announcement is great news for the state, particularly for the hundreds of thousands of people in Illinois who currently are without health insurance. So beginning in October, many of those folks will finally be able to sign up for coverage they need and deserve thanks to this new marketplace strategy. The market will make finding the right health insurance plan less complicated and more affordable than ever before. Comparing and understanding plans will be easy and straightforward. People with pre-existing health conditions, and a lot of our citizens have pre-existing health conditions, won't be turned away or locked out or shut out of the new market. And tax credits will be available to help people who need the financial assistance. And what that means for thousands of citizens in Illinois and across this country is that the security of affordable health coverage will finally be within reach of many of our citizens. The marketplaces will also provide relief for Illinois small business owners. Now, what I know is that for years, small business owners are at the wrong end of the insurance market. Their premiums skyrocket much faster than wages and revenues, making it hard for employers to afford coverage that meets the needs of their employees. And what I hear over and over again from small business owners is often they lose their employees to larger competitors because of health benefits, because their best workers feel they have to go down the street or around the corner or across town to work for someone else to provide that health stability. Those days are coming to an end. In October, those small businesses will finally have a reliable way to buy affordable coverage for their workers, and they'll have the buying power finally that their large competitors have in the market. Insurers in the marketplace will have to compete for customers, which will also help to keep costs down. So ultimately, today's announcement is good news for all the people of Illinois. When our family members, friends, and neighbors have health insurance, we all benefit. We benefit from a healthier, more productive workforce. We benefit when kids can be in school learning instead of at home with a preventable illness. We all benefit when our premiums aren't inflated to cover the costs for those who have no insurance. And we all benefit when changing jobs or retiring early or going into business for yourself doesn't mean losing access to affordable health care. Much more work remains to be done in the coming months, but today's announcement is an important step forward. And I'm here to say I look forward to working with Governor Quinn and his team to make affordable health coverage a reality for all the people of Illinois.
I guess I will start by saying that I am an immigrant from Guatemala, Central America. and I have been in this country for 37 years. All of those years have been without insurance. Today, I can so happily say that that is not longer going to be just a dream to have affordable insurance. I work very hard, and I teach my children. I have two wonderful children, Joshua and Melissa, who have been covered under the umbrella of Erie Family Health Center, as I have been. We couldn't do without Erie because these people are truly caregivers, And for someone like me who cannot afford health insurance, Erie has been our salvation. I'm only one of the lucky ones because my health has been pretty good. And that is, I honor that to Erie because we try to do preventive health care. And our wonderful partners, Northwestern Hospital, has provided me, along with many other women, with yearly mammograms, which are so important nowadays. I am so grateful and so honored and humble to be able to stand here before you today. I can only remember when my son Joshua was born. It took us 3 years for us to be able to pay for his birth. Melissa, my second daughter, was blessed because all my prenatal care was done here at Erie. And that was a love affair that started when Melissa was in my womb. I do thank Governor Quinn and you, ma'am. I am so, and President Obama, who is a wonderful leader. I am so proud that he's our leader. I voted for him. I cheer for him. And every time he would say, we can do it, sí se puede, sí se puede.
Woo!
We can do it. We can do it.
Very good.
Thank you very much.
Oh, wow.
Yes, please tell him.